Jennifer.
Hi, Teresa.
It's the 1st of September, so it is time to do some leader rounding.
Yes, indeed.
So thank you for coming in today.
You're welcome.
I just wanted to start off with asking you, how's the house building going?
It's going well. It's going well. Coming along.
Good. And the boys, how are they doing?
They're doing good. Started back to school. Everybody's doing good so far.
Oh, I'm glad to hear that.
Yeah.
Today, I see that you're managing a Pitocin patient, an induction, with the guidance of your preceptor. How is that going for you today?
It's going very well. It's going very well.
Oh, good. I'm so glad to hear that. When I rounded on Tracy last month, I wanted to tell you that she said that you're doing a great job with orientation.
Thank you.
I hadn't had an opportunity to tell you that yet, but she said you're catching on so quickly.
Thank you.
So I just want to say you're doing such a great job.
I've had a lot of great help with that, so I really appreciate that.
Good. Is there any care provider or associate that I could recognize or give a kudos or anything? It doesn't have to be in our department. It could be another department that you can think of.
The lab tech that came up today
Okay.
to assist us today, Abby?
Angie.
She was very helpful and went above and beyond, what her duties were this morning to help us.
And that was when we had a little challenge with getting that test.
Little challenge with getting a test read and everything,
Okay.
and she was able to come up and assist us with an alternate form of that.
Well, I'll make for sure I'll get that sent to her
Okay.
and her director. Is there a physician I can recognize, and why?
I would like to recognize Dr. Jones. He's been very kind to me, a newbie here on the floor. I have felt respected in the position that I'm in, and the communication with him I felt has been great with patient care and just following through.
Okay. The last time we rounded, had leader rounding last month, you had mentioned thermometers. They were very difficult to find on the unit.
Yes.
When I asked you about tools and equipment. We kind of did a little inventory count when we had that on our stoplight report. How do you feel about that now? Do you feel like we have the appropriate number?
I feel that maybe it would be appropriate this time to look into getting another Dynamap.
Okay. And why would you say that?
I would say just the accessibility.
Okay.
When the floor is pretty busy, and just having them in locations that are accessible to our patients, to get our day flowing a lot better.
Okay. Well, I'll definitely write that down, and we'll evaluate that for equipment. It's time to do budgeting, so we'll
Okay.
definitely look at that. Are there any systems you want to approve, and your ideas to help with that improvement?
A system kind of came to our attention here recently, maybe with our staff assist buttons.
Okay.
Not something we use all the time, but it's very necessary. And all the different reasons for staff assist kind of have their own little sound, and I think sometimes we get a little used to ignoring buzzes and beeps and letting them go. And sometimes in an emergent situation we need to know what that sound means so that we can respond appropriately. I think maybe if we did some drills on the floor.
I like what you're going with here. That kind of goes into the next question about safety. So would you be okay if I added that to our stoplight report?
Yeah.
Maybe me and you could work on that
Oh,
together.
absolutely.
That sounds really fun. Because as I'm sitting here pondering, we've got several bells and whistles. We've got IV pumps. We've got call lights, emergency lights. We've got cell phones, maybe ringing, phones ringing.
We just ignore it.
Staff assist lights.
Absolutely. We have a lot of new employees here on the floor, and we don't always have a situation during orientation that calls for the use of those. So I think a drill would be great, and making sure everybody knows what they are and what they're for and what they need to be, how they need to be responding to those.
Auditory awareness.
Yes.
Oh, I like that. Patient experience and what our patients are saying. I kind of talked to you about this, but I want to share it again when I was rounding and what our patients are saying about you. I keep this binder on the unit. It's pretty transparent. And underneath this People tab, you can go back and you can look this past month. You can see where you've been mentioned, recognized 3 times by our patient. But one moment really steps out for me is this patient was in tears, and I was kind of in tears too. If I cry, I have these cute little Barbie Kleenexes that I got from somebody, but I'll try not to. And she just went on and on about how you just really made her experience here wonderful. She had a birth plan. Things did not go the way that she wanted them to go, but you made a difference because you held on to the one piece of her birth plan that meant a lot to her. And when she got taken down for a C-section, you took the baby and put the baby immediately to her cheek and nestled the baby here to her neck so that she felt her baby's skin to her face and her neck. And she said she will never forget Nurse Jen, ever in the rest of her life. She was just had tears down her face, and I'm sitting there and I've got little tears too. So why did you want to become a nurse, Jen?
I wanted to be that good nurse. I've had situations where I've been in the hospital for one reason or another, at the birth of my children and ill family members, and there have been those good nurses and those bad nurses, and I wanted to be that good nurse for somebody.
Yeah. Well, our HCAP scores are improving. We need to be 80 and above, and that's just a score. We just got to focus on having those great patient experiences. We're at a 75 right now, so we just need to keep up those great experiences for our patients. I wanted to go over, do you have any tough questions that you need to ask me that you can think of?
Not at this time.
Okay. The things that I'm hearing with rounding, we're focusing on pain management. That's where we're writing the medication on the board, and the last dose given, next dose due. We're working on responsiveness, and we're working on medication explanation of side effects.
Yes.
How do you feel you're doing with those things?
I feel I'm coming along. I'm learning more, and I've had those situations where I've had to go into detail with the patient, explain, this is why the doctor is, prescribing this for you. And I think having that communication, being there, hearing what the doctor's saying to the patient, and backing them up so the patient feels comfortable in their care and everything. It's coming along.
Great. Do you know what ADIT means?
I do. So ADIT is AIDET, and A stands for acknowledge. So when you see someone, you look at them, give them eye contact, and smile. I is, sometimes when I get into it, I forget. Introduce, yes. Introduce yourself. Make sure you've got your name badge in sight and everything. D is for duration. How long are you going to be here? How long until you expect to hear from the physician? E is for explain, why are you here? Why are we doing this? Why are you getting this medication? And T is just a thank you.
Yes, that's great. That sounds great. Is there anything that I can help you with right now, or is there anything that I can do better to be a better leader for you?
I think things are going well. As far as I am concerned, I appreciate the communication and the open door that you have provided to us. Leaving books like this out and open so that we can review them and feel comfortable with them. I think our times in our huddles, our cuddles as we call them.
We don't huddle, we cuddle.
Yes. Are just helping everybody in the communication and helping us feel as though we can get the job done that we need and we have the resources that we need.
Okay. So from our rounding today, I am going to send out a reward and recognition to Angie and Dr. Jones,
Okay.
and then add to our stoplight report, maybe we'll look at your calendar, my calendar, and we'll plan some kind of drills on our new little bells and whistles. And then, do you know where the stoplight report is?
I do. We can access it on the G Drive, and we keep a copy out on our bulletin board out here, and you should have a copy of it here in this book too.
I do. All right. Well, it was great chatting with you.
Thank you.
I hope your patient delivers before you go home today.
I do too.
All right. Well, thank you.
Thank you.